Hello, everyone. Today we'll be exploring the cranial nerves, which are a crucial part of the central nervous system. By the end of this presentation, you'll understand what the cranial nerves are, how they function, and why they are important in daily life. So, what are cranial nerves? The cranial nerves are 12 pairs of nerves that emerge directly from the brain rather than the spinal cord. They are numbered using Roman numerals and are arranged in the order from the front of the brain towards the back. Each cranial nerve has a specific role, carrying sensory information, motor signals, or both, to and from the head, neck, and organs. Nerves are classified into three main groups. Sensory nerves, which carry information like smell and vision, for example, the olfactory and optic nerves. Motor nerves, which control movement, such as the trochlear and hypoglossal nerves. And mixed nerves, which carry both sensory and motor information. Such examples include the trigeminal, facial, and the vagus nerves. Cranial nerves are vital because they serve as the direct connection between the brain and the head, neck, and even some internal organs. They are responsible for many of our key senses, including smell, sight, taste, hearing, and balance. They also control essential motor functions, such as facial expressions, swallowing, speech, and much more. In short, cranial nerves are the communication highways that allow the brain to sense, move, and regulate critical functions throughout the body. So many, we need mnemonics, right, to remember these. So for the names of the cranial nerves, one popular mnemonic is OOO, to touch and feel very green vegetables. And with that, we have the olfactory, the optic, the oculomotor, the trochlear, the trigeminal. The A is going to be the abducent. The F is going to be the facial. V is the vestibular cochlear. The G is going to be the glossopharyngeal. And then we have the vagus and the accessory. Okay. Be mindful that we have all of them located there, but we also need to be worried about the functions as well. So remembering the functions, we have some say money matters, but my big brother says big brains matter more. And this allows for us to know whether or not it's sensory, motor, or both, right? These memory aids help us because it's much easier to recall the cranial nerves in order along with their basic functions. More in depth. Cranial nerve 1 is the olfactory nerve. It is a sensory nerve responsible for the sense of smell. It begins in the olfactory bulb and connects to the nasal cavity. Clinically, it can be tested by asking a patient to identify familiar scents, such as coffee. Cranial nerve number 2 is the optic nerve. This is also sensory and it carries visual information from the retina to the occipital lobe of the brain. We can test it through visual fields and visual exams. Cranial nerve number 3 is the oculomotor nerve. This is a motor nerve that controls most of our extraocular muscles. It is responsible for eye movement. It plays a critical role in pupillar constriction and eyelid elevation. Clinically, it can be tested with the follow the light test and by checking pupillary responses. Cranial nerve number 4 is the trochlear nerve. It is a motor nerve that controls the superior oblique muscle of the eye, which moves the eye down and inward. Clinically, we test it by asking the patient to look down and in. The cranial nerve number 5 is the trigeminal nerve. This is a mixed nerve carrying both sensory and motor functions. The sensory branches have the ophthalmic, the maxillary, and the mandibular, and they provide sensation to the face. The motor portion controls the muscles of chewing. Clinically, it can be tested by light touching the forehead, cheeks, and chin to check facial sensation, and by assessing jaw strength. Cranial nerve number 6 is the abducent nerve. This motor nerve controls the lateral rectus muscle, which allows the eye to look outward or sideways. Clinically, we test it by asking the patient to follow the examiner's finger as it moves side to side. Use the following time to answer this question. The trigeminal nerve is responsible for both sensation in the face and motor control for chewing. Which activity would be most affected if the trigeminal nerve was damaged? Cranial nerve number 2 is the facial nerve. This is a mixed nerve with both sensory and motor functions. It controls the muscles of facial expressions, and it provides taste sensation to the anterior 2/3 of the tongue. And it also contributes to salivation and tear production. Clinically, it is tested by asking a patient to smile, raising their eyebrows, close their eyes tight, and sometimes a taste test. Cranial nerve number 8 is the vestibular cochlear nerve. This is a sensory nerve responsible for hearing and balance. Clinically, hearing can be tested with a simple whisper test, while balance can be evaluated with tests such as the Romberg test. Cranial nerve number 9 is the glossopharyngeal nerve. This mixed nerve provides taste to the posterior 1/3 of the tongue and plays an important role in swallowing, salivation, and the gag reflex. Clinically, it is tested by checking the gag reflex and sometimes by assessing taste at the back of the tongue. A patient can't taste food on the front of their tongue and can't smile. Which of the following nerves is affected? Nerve number 10 is the vagus nerve. This is a mixed nerve with wide-reaching functions, including parasympathetic control of the heart, lung, and digestive tract. This is very important. It also plays a role in swallowing and speech. Clinically, it can be tested by listening to a patient's voice and checking for symmetrical movement of the uvula when you say ah. Cranial nerve number 11 is the accessory nerve. This motor nerve controls the sternocleidomastoid and the trapeze muscles, which are responsible for shoulder and neck movement. Clinically, we test them by asking a patient to shrug their shoulders or turn their head against resistance. Cranial nerve number 12 is the hypoglossal nerve. This motor nerve controls the tongue movement, which is essential for both speech and swallowing. Clinically, it is tested by asking the patient to stick out their tongue and observe for any deviation or weakness. Something that is important to note is when cranial nerves are damaged, the effects can be serious and specific to each nerve. For example, damage to the optic nerve can lead to partial or complete blindness and significant vision loss. Injury to the facial nerve may cause Bell's palsy, a condition that results in sudden weakness or paralysis on one side of the face. Damage to the vestibular cochlear nerve can cause hearing loss or problems with balance, such as vertigo. And finally, injury to the vagus nerve may cause a difficult in swallowing, changes in voice, or even problems with autonomic control of the heart and digestive system. Understanding these disorders can help us connect anatomy to real clinical practice. Cranial nerves are essential for sensory and motor function. They are key to communication between the brain and the body, and if damaged, they can significantly affect our daily life. That I use.